Hi, have you heard of the Low Country Food Bank's Wellness Pantry? Are you already a wellness pantry? Through this training, we're going to share the baseline requirements to become a wellness pantry, the strategies used to influence clients' well-being, and the steps we take together to create the wellness pantry environment.
Wellness Pantry is a designation given to the Low Country Food Bank pantries that partner with us to take steps to create an environment focused on improving the client's overall well-being. The strategies we use are simple shifts in the environment that influence clients' food selection and preparation behaviors. These strategies are low cost and easy to implement in most client choice pantries. Let's start with the baseline requirements pantries must meet to become a wellness pantry. The pantry must be a 100% client choice pantry, set up the pantry by food groups, and have a designated pantry staff or volunteer that will take the lead on the wellness pantry initiatives.
Once the baseline requirements are met, pantries can begin the journey to becoming a wellness pantry.
As a wellness pantry, we want to make sure there is a balance of food items available and that the clients are empowered to make the best choice for their family's health. By setting up a client choice pantry that focuses on the My Plate 5 food groups, pantries give clients the dignity of choice while being able to encourage a balanced selection of food items. Wellness pantries receive a client bag food guide to share the number of food items clients should select from each food group to get enough nutrients for their entire family. The food bag guide is based on providing families with all of the nutrients they need for 3 days. You will notice that the emphasis is on getting a variety of fruits and vegetables and balancing the rest of the items to create healthy meals. Following the food bag guide also helps pantries understand how to select items from the Low Country Food Bank shopping list that will effectively fill their shelves. If an individual is to get 4 protein items and you serve 20 clients a week, you would need to make sure that you have 80 protein items on your shelves to meet the need. Now we know that not all pantries are able to provide all of the food suggested. This is where education comes into support. If a pantry does not have enough of a specific food group, we encourage educating clients on how to best utilize their SNAP or food budget to get these items. With a strong focus on fruits and vegetables, all wellness pantries are encouraged to have a minimum of 3 different fruits and 3 different vegetables available. And as most of you know, we all want our wellness pantries to work towards making fresh fruit and vegetables available. The agency relations team has strategies to help you reach this goal. To further guide pantries in making healthy options available for clients working to manage good health, Low Country Food Bank has identified foods that are low in sodium, sugar, and saturated fats, and given these foods the label of Foods to Encourage or F2E. Items that do not meet the F2E guidelines simply need some extra education about the best way to prepare them to reduce the sodium, sugar, and saturated fat. Wellness pantries are encouraged to look for the F2E label on the Low Country Food Bank shopping list.
Now that the pantry is organized and stocked, let's talk about the key strategies we use to educate clients. These strategies are nudges and education-based outreach. Nudges are low-cost environmental cues that influence the selection of food and ultimately the preparation of that food. The Low Country Food Bank has created and purchased materials for each wellness pantry to implement nudge strategies. Key nudges are signage, strategic food placement, creative food pairing, and nutrition education displays. First, signage helps to draw people to certain foods or to influence the preparation of the food. Low Country Food Bank wellness pantries receive signs to identify the different sections of the pantry, like fruits, vegetables, protein, and also shelf tags that share tips and tricks to best utilize specific foods and draw attention to food that meets specific health needs. An example is placing a shelf tag next to low sodium vegetables, recognizing that these are good for people with high blood pressure. Simply putting a special symbol near Foods to Encourage foods that are low in sodium and sugar help clients who are working to manage good health easily identify these foods. Items that do not meet F2E guidelines are the perfect food to pair with a shelf tag, or you can add a visual cue that nudges clients to prepare them in a way that makes them a better meal option. An example from one of our partners is placing a colander near high sodium vegetables to visually remind clients to rinse their canned vegetables. Next, we have attractive placement of food through utilizing decorative bins, baskets, clean shelves, and tablecloths to create a welcoming space and to draw clients' attention to foods we want to encourage more often. Wellness pantries are prioritized for grants that we pursue to help acquire these supplies. We also encourage pantries to put the items we want clients to select less often at the far end of the table or on the bottom or top shelf and any other hard to reach place. Focus on making the F2 items more visually appealing and place the other foods a little more out of reach. The clients will get a good stretch or a squat when going for these items. Third, we use creative food pairing, encouraging clients to make meals such as a burrito bowl. Simply bring together rice, beans, canned chicken, and tomatoes with a recipe for a burrito bowl and place an eye-catching sign next to it. Recipes and other resources are made available for pantries to be able to do this with items we see most often. One special resource we've created are picture-based recipes for pantries to utilize to help overcome literacy or language barriers. Reach out to the nutrition team if you haven't seen these yet. The next thing we use are nutrition education displays such as posters, a bulletin board, and handouts that should be placed around the pantry so that clients can learn while waiting to select their food. Wellness pantries receive posters visualizing the amount of sugar or fat in foods, as well as a poster teaching how to read the food label to identify healthy foods. Pantries also receive a bin full of nutrition education supplies. These supplies can be used to set up an education table. We encourage this visual display to be placed in the waiting areas so that clients can interact with the learning experience. The table can be manned by a volunteer or simply left for clients to engage with on their own. If your clients wait in a line, put the education display on a cart and roll it down the line to teach them while they're waiting. To further assist wellness pantries in empowering their clients with knowledge and skills, the Lowcountry Food Bank Nutrition Team has created a safe sampling training for pantries to view and learn how to use recipe sampling as an educational activity in the pantry. Recipe sampling is an effective strategy to encourage clients to try new foods or new techniques for preparing familiar foods. The recipes available on the Nutrition Center portion of the Lowcountry Food Bank website are easy to prepare recipes that have been tested and loved with clients across the Lowcountry.
A wellness pantry is focused on more than just food. We ask that pantries identify opportunities in their community for clients to receive information and services to manage their health. These services can be brought to the pantry for clients to engage with while they are waiting or simply advertised on the Wellness Pantry bulletin board. Some suggestions from our partners are to set up health screenings with local medical programs, partner with a hairstylist or barber to provide free haircuts while clients were waiting, advertise health fairs and classes available in the community, and provide information on safe physical activity opportunities. Wellness pantries look at the client as a whole and provide information, education, and services to help clients receive the resources and information they need to be well. A strong wellness pantry does not stay stagnant, but changes their environmental cues and education at least every 3 months. Guides for switching up the pantry tools and environment are given to partners so that together we can continue to educate and empower our community.
Knowing the requirements and strategies is important, but what steps do we take together to get there? The Lowcountry Food Bank Nutrition Team provides a training for pantries to learn how to create the wellness environment and employ these key nudge strategies. At the end of the training, pantries select the supplies they need to get started. With each pantry being unique, we ask new pantries to take the 30 days following the training to set up their pantry with the wellness focus and tools. After 30 days, the nutrition team sets up a visit to see how the initial setup went and to provide expertise and suggestions for making their strategies even more effective. We call this an interior design visit. Once the pantry has their site visit and integrates the nutrition team's suggestions for improvement, the Lowcountry Food Bank Pantry receives their official Wellness Pantry designation. A window sticker is provided to be able to proudly advertise this special designation. The journey doesn't end with the sticker. We want to know how your work is reaching the community. To track the reach of our wellness pantries, we have incorporated a wellness pantry section in the monthly meal report. Pantries are simply asked to keep track of the number of households served each month, the number of people reached through the Nutrition Education Toolkit, the lesson you used for education that month, the number of handouts provided, and any wellness activities completed outside of your regular food distribution. These reports allow our nutrition team to share the reach of the great work you are doing, as well as to continue to receive funding for our wellness pantry strategies. The wellness pantry model is ever evolving as we learn together. Continued coaching through site visits, emails, and in-person convenings allow for each of us to learn from one another, and for the nutrition team to create tools to support your continued impact with this model.
We start with the basics and build from there. Established pantries can help new pantries grow, and together we will help the community improve their health. Are you the next pantry to help impact the community's health and well-being?